Hi, my name is Dr. Lorian Taylor. I'm an RD PhD and the CEO of LifeMD. I am so glad to be here with you today.
My name is Leah Thompson, and I am a therapist in private practice. I have been working with IBD patients for over 12 years,
Oh,
and I work with people for a wide variety of reasons, including anxiety management, illness adjustment, and trauma therapy. And I'm happy to be here too.
Leah, you have seen probably hundreds of patients in your experience. What do patients most often report is their most stressful symptom?
So, Lorian, I think I've probably seen thousands, and by far the most anxiety-provoking symptom that people have is urgency or incontinence. Some people, when they're in a flare, live in fear of having an accident or having to find a bathroom on short notice. So, and there's a few reasons why this is such a distressing symptom. One, I think we all like to be in control, particularly of our bodies, and we look for predictability in our lives, especially because so many things in our lives are out of control. And two, the shame of not being in control of your body, something that you've mastered early in childhood, is just so intense. And as a result, long after a flare has passed and the symptom is no longer a problem, people often still struggle with anxiety.
That is so understandable. Is there a difference between urgency and incontinence, or are they the same thing?
So, Lorian, I'm not a doctor, but my understanding of it is that urgency is about not being sure whether or not you're going to get to the bathroom on time. And incontinence is when you have absolutely no control.
I can so understand that this is very anxiety provoking for patients if they're not close to a washroom. So, how are their lives impacted by this?
Oh, Lorian, I mean, patients plan their lives around access to a bathroom. So, and it's so overwhelming that it actually stops people from participating in social activities. So, even something as simple as going to a restaurant. And part of it is that people are worried about what they can eat, but the other part is they worry about being stuck in a bathroom for an hour or 2 hours, and then coming back to the table and having to explain to people why they were gone for so long. So if you think about it, you may not want to explain to everyone or to people you don't really know that well why you were away from the table. And so the secrecy and the shame compound the anxiety to the point where you would almost call it dirty suffering.
So, what is dirty suffering?
Dirty suffering is when you have anxiety and then you have shame about that anxiety.
Right.
It's so intense and it almost doubles the experience of suffering as a result. And, people often also avoid outdoor activities. They avoid hiking in the mountains because they don't know when or if they're going to have access to a bathroom. And sometimes people just cancel events and they'll make excuses to their friends. And this leads to feelings of guilt. And it also makes people feel as though they're letting down their friends and they start to worry that they might even lose these friendships. So it can be very distressing.
I can understand that because these things happen, you cancel some on some people maybe even at the last minute, and you don't really want to explain about why you have to cancel. It's
Absolutely.
Yeah, especially to people you may not know that well.
Absolutely, and people don't want to explain, and so
No.
they're left feeling like they're letting people down, and they really don't have a way of communicating about it. And so for most people, this interferes with their lives.
I can imagine it's very anxiety provoking. So, what do you think is the social event that most creates anxiety for people who are having these symptoms?
So, Lorian, over and over and over again, patients have told me that the most anxiety-provoking event for them is getting into a car. When they're in a
Wow.
flare, getting into a car causes them so much stress because they're worried about getting stuck in the car with no access to a bathroom or getting stuck on the side of the road. I know of some patients who've actually considered putting a portable toilet in the back of their car just because they worry about it so much. But in extreme cases, patients actually avoid leaving the house. They worry about being in meetings. They worry about having to suddenly leave a meeting because they have to get to a bathroom. And I know a lot of teachers who are patients who started to fear standing at the blackboard because they were worried about having an accident in front of 5 or 6 year olds. And if you think about it, like, how can you focus on work when you're feeling this way?
Yeah, no kidding. I mean, how to explain? Even in a workplace setting, how do you explain to 5 or 6 year olds? I can just see how difficult this can be.
Oh,
So
impossible. Not only
yeah,
difficult, but impossible.
yeah. And now, okay, I have a question. It's a little bit taboo, but what about sex?
So, Lorian, that is such a big fear, especially for women. So, and it's one that they don't mention to their GI specialist because they're so embarrassed about it, but it definitely interferes with their quality of life and the quality of their relationships. Some women have told me that they avoid dating when they're in a flare because they're not sure about whether or not they'll be able to have sex without this kind of embarrassment. And people end up missing out on such important parts of life. And it's devastating for people.
Okay, I'm so glad we're talking about this and helping patients to understand that this is normal and that lots of people go through this. Um, let's talk about some of the treatments. So, what are some medical treatments that can help this issue?
So there are tons of medical treatments that can be helpful. But the thing is that people are so ashamed that they often don't even bring this up with their healthcare team or their specialist. But there's definitely some treatments that can help this out. So depending on the root cause and if there's inflammation in the rectum or in the colon that affects muscular control, suppositories, enemas, mesalamine, or even biologics can be prescribed.
Okay.
But it's something that you have to speak about with your specialist and they can determine what the root cause is. So I cannot emphasize enough how important it is to speak to your specialist, even about symptoms that you think are embarrassing, because chances are they've heard this 1,000 times before.
Right.
And it is 100% normal. But often I find that patients with IBD suffer in silence because they think that it's just a symptom that they have to learn how to live with. They think that it's just a
Right.
part of having a chronic condition and it's just something that they have to cope with. And it's just so not the case.
Yeah, that's a really good point to think that patients just deal with it. It's like, oh, this is just part of my disease now. This is my life, but they don't have to.
No, absolutely not. And in addition to medical treatments, there's also some dietary strategies that can be
Right.
used. And Lorian, using your experience as a dietitian, what are some dietary strategies that can help with this?
So, one of the first things I typically would recommend would be a psyllium fiber supplement like Metamucil, but I always tell patients don't follow the instructions. And of course, this may not be appropriate for patients with strictures. But the trick is really just to start with a very low dose, like 1 teaspoon, a few hours potentially before bed, especially if people are having to get up and not sleeping well because they have to go to the washroom. And just start with that teaspoon dose once a day, see how you tolerate it, and then slowly increase over time to around a tablespoon 3 times a day. And what psyllium fiber does is it forms a gel in the gut. So it really just grabs on to all of that fluid that can create this sense of urgency and it firms up loose stool. Other ones I think that probably people know about because they've experienced it is caffeine. That can definitely make urgency worse. So decreasing intake of caffeinated tea, coffee, or even pop can make a difference. And what's really interesting is we just finished an intermittent fasting study where patients with IBD fasted for 16 hours and then they ate for 6 hours. So an example would be they stopped eating at 7 p.m. and they started eating again the next morning at 11 a.m. And one of the biggest changes that we saw in that study was decreased in number of stools. So
Oh, wow.
intermittent fasting may also be really helpful.
Wow, that's so interesting, Lorian. And it's good to know. I mean, intermittent fasting has so many applications.
Yeah, it really does. Um, I think, it's just really touching me that it's really sad that people don't get the help that they need. So I'd like to ask you a bit more about the anxiety, the symptoms, because really you've talked to so many patients about this. So patients, they go through this and maybe it resolves, but does that anxiety persist even when urgency is no longer an issue?
Absolutely, it does persist. And it's because being in control of our bodies is just so important. And not being in control of our bodies is it's such a vulnerable feeling. And what people experience from this is actually a form of small t trauma. So it's not a case of full-blown PTSD with all of the symptoms that go with that, but it's just an experience that overwhelms your coping capacity at the time. So people just end up with so much anxiety and shame surrounding these experiences, and they just never want to encounter these types of situations again. I've talked to moms who've ended up in gas stations at the side of the road with two toddlers, dragging two toddlers into a gas station bathroom. It's not something people really dream about doing. And so, as you can imagine, it's something that they just don't want to repeat. So some people end up with very profound anxiety about this. And so it's not really surprising when you think about it.
No, not surprising at all. So what can patients do to cope? Let's give,
So
like, what are some ideas?
so first of all, Lorian, there's two parts to it. One is about anxiety management and using distraction strategies, and the other is just basic problem solving. So many patients keep an emergency kit in their office or in their car with a change of clothes and some things they need to clean up. And I know people don't want to resort to this, but you need to work, you need to take care of your children, you need to live your lives, and life just doesn't stop because you're in a flare, because you have a chronic condition. So, I mean, you have to take precautions. And the
So
other,
it's almost like an emergency urgency first aid
yes, exactly. It is an emergency urgency kit.
kit.
And the other part is the anxiety itself. So, and the anxiety has two components. And one is the tendency to overestimate the likelihood that a bad incident is going to happen, some kind of an accident. And the other is to grossly underestimate your ability to manage it.
Okay,
So there's people out there in the audience who are not going to want to hear this, but you have to reach a place of acceptance that an accident could happen.
right.
And it's not the end of the world, and you can learn to cope with it and survive it relatively unscathed. And the more you fear the possibility of an accident, the more your mind focuses on it. And the more you focus on it, it amplifies in your awareness and you can actually make it happen. So the influence of the mind on the body, Lorian, is so powerful. And if you keep thinking about something, you can actually make it happen. But if you stop resisting it, if you stop fearing the worst possible outcome, the anxiety will subside. And one strategy to use to restore a sense of calm, like in a situation like in a car, for example, is to use a form of a breathing strategy. So it could be diaphragmatic breathing, it could be box breathing, it could be 4-7-8 breathing. And the purpose of this is just to deactivate your stress response. So you slow down your breathing, and what happens is you can actually start to kick in your parasympathetic nervous system. So being stressed out in and of itself activates your sympathetic nervous system and creates the very problem you fear, ironically enough. And this is what you don't want to happen. So if you use a form of breathing, you can start to calm yourself down. So 4-7-8 is where you breathe in for 4, you hold for 7, and you breathe out for 8. And you
Okay,
focus on counting and you focus on the breathing. So what this does is it slows down your heart rate and it slows down racing thoughts. So it really does help to calm down. And box breathing is where you breathe around the sides of a box. So you breathe in for 3, you hold for 3, you breathe out for 3, and you hold for 3. And you repeat this until you feel calm. Now, it doesn't really matter what number of counts you use. You could count in for 4 and hold for 4. It really is just about what you feel comfortable with.
okay.
So,
So
yeah.
what if people don't like the breathing exercises or it doesn't work for them? Is there other things that they can try?
Absolutely. And not everybody finds that breathing exercises do work for them, right? Some people find it very difficult to do. And some people feel that it actually increases their stress to do this.
Oh, wow. Right.
So, one thing you can try is a grounding strategy. And one grounding strategy that often works is called 5-4-3-2-1. And this is where you shift your mind to an external focus. So you shift your mind to focus on something outside of your body. So you could focus with 5 things that you see, 5 things that you hear, and 5 things you feel on or in your body, like your hands on the steering wheel. And the other involves, and then you go down. So you go from 5 things to 4 things you see, feel, and hear. 3 things you see, feel, and hear. And what this does is it helps you to ground yourself in the present moment. And the other involves distraction, such as counting backwards from 100 by 3 or by 7, or
Okay.
by using a game similar to I Spy, where you find all things that are red or things outside of the car that are blue. So you can involve your children in this if they're in the car with you, or you can do it when you're alone. So anything that engages or redirects your mind is helpful.
Okay, I don't know if I would do that 100 counting backwards thing. I think that might be more stressful for me than relaxing. But
But it does engage your mind, Lorian. It does engage
it
your
would
mind.
engage my mind. You're right. And I would probably be very proud of myself after. Um, okay. So you're in the car, you've tried these techniques and they're not working. You're still feeling very anxious. What's next?
So if you find that over time you just can't stop worrying about this, so you no longer have the symptom and it's just still a problem for you, it might be a good idea to see a therapist about some other approaches. So it might be that your experiences were just so much more traumatic than you thought they were, or they were overwhelming than you realized. And you need a method that will help you to rewire the pathways in your brain.
Okay.
So one of these methods that could be great is EMDR, and that's eye movement
Okay.
desensitization reprocessing.
Wow. That's a big word.
It's a big word. And then the other is clinical hypnosis, which most people have heard about. So
Okay.
with EMDR, it involves bilateral eye movement, so left to right eye movements, or left to right taps, or left to right tones, to help the
Okay.
brain reprocess traumatic events. And it's a little bit complex to get to in such a short presentation, but
Right.
the result is it helps you to reduce your distress level, and past events that were once very anxiety provoking no longer bother you as much. So negative thoughts and beliefs can be changed and replaced with more positive and empowering thoughts that can help you to cope better with these situations. So
Okay. And for hypnosis, like
yeah.
I don't know if people might think it's a little woo woo or like, is
Mhm.
this like when you go and get hypnosis to stop smoking when from a guy on a stage? Like, what are the difference with this type of hypnosis?
Well, so I think people have a lot of misconceptions about
Yeah.
hypnosis because of what they've seen on movies and what they've seen on TV. And so the answer to that question is complex. It's yes and no. So hypnosis is actually a skill that you learn. And this is what I tell patients. It's something that you develop over time. And self-hypnosis can strengthen your relaxation response. So it can help you to be able to
Um,
relax in these situations and regulate your emotions more effectively. And as a result, you can activate your inner resources and focus on a more positive outcome. So it can be really helpful for this.
So where would someone go? Like you said, self-hypnosis. So is it something they teach themselves or do they get someone to help them with it? How does it work?
I think it's always because people have very specific goals. So it's always a good idea to go to a therapist to start with,
Right.
at the very least, to get some help with learning some of these skills. And then you can start to apply them on your own. But really, what you want to do is develop a sense of inner calm in these situations and be able to refocus on something that's more positive.
Okay. Yeah, that totally makes sense.
Yeah. So, Lorian, do you know of any other lifestyle strategies? Maybe some that are not as woo-woo
I'm sorry,
that
I
can
didn't really
help
mean
people.
woo-woo.
Yeah.
Um, I think we at LifeMD, we do have a few programs because again, this is something that patients have really asked us a lot about. So we do have a gut hypnosis program that patients can use, particularly to help with relaxing and to feel better with their GI symptoms that they're having. We also have a kinesiologist-led pelvic floor program for patients that have bowel urgency. And this is was tested in a randomized controlled trial. And what patients found is that after 6 weeks of the exercise program, they could squeeze their rectum much tighter. They had much lower levels of bowel dysfunction and their overall muscle strength improved. And of course, when you exercise, your mood improves, your depression goes down, your anxiety goes down. So it just had a lot of multiple benefits. And the other thing patients can do too is I know that it may feel embarrassing, but this is also something that can be discussed with a physiotherapist who specializes in pelvic floor physiotherapy. And remember, 50% of us are women, and many of us have had babies. And when we sneeze, we can also pee our pants. So talking to a physiotherapist, this is something, believe me, that they've heard about before.
Absolutely, Lorian. And this is something that so many people need. And it can be so empowering. It can really make people feel like they have more control over this symptom.
Well, thanks so much, Leah. This has just been excellent information. I feel like I've learned so much.
Thank you, Lorian. It's been a pleasure being here.
Great.